is unrealistic to us is realistic to a person with dementia because their reality is not our reality. And so therefore we have to accept the reality as they perceive it rather than seeing it the way we see it. And how often does this behavior occur? Is this every day? Is it every week, every month? Is it 10 times a day? How serious is it? And how much attention should we pay to it? Just to give you some examples of internal and external causes of behavior. Here are a few internal causes of behavior. Pain is a very, very common situation with persons with dementia. And one of the ways they may respond to that pain is by withdrawing. They may withdraw from you into a corner. They may sit in a huddle. They may even go into something like a fetal position when they're feeling in pain. Fear is an overwhelming emotion in people with dementia, and I cannot say enough about how often this is at the heart of dementia. You may see people exhibiting tearful behavior. Again, withdrawal can also be a symptom of fear, obviously running away or hiding. Those are all symptoms of being fearful. Frustration is a very, very common emotion because these people are losing touch with everything. It is often said, and I believe that I have seen some books that have been written on the subject, and the authors have talked about losing themselves. When a person has dementia, they are losing everything. And the amount of frustration that is experienced is something that I cannot even imagine. When people are frustrated, often they become aggressive. So aggression can be a response to an internal emotion of frustration. But there are also external causes, and here are just a few to think about. Temperature in an environment can cause a reaction. Sometimes we see people removing their clothing. This seems bizarre and very puzzling to us, but probably the simplest explanation is that the room is just too warm for these people. And instead of saying, could you turn the thermostat down or open the window, they are removing their clothing. This is the only way they have to express the fact that they're too warm. One of the other external causes of behavior may be the people who are surrounding the person with dementia. One example that I can think of, which is very common, is a group of people in a dining room situation or in a situation in activities where an individual person who may have been fine yesterday, today shows up for an activity or a meal, and your patient or your person suffering from dementia may react in a very aggressive or scared way, even though they may have tolerated this person very easily on Monday. On Tuesday, they will, because of their dementia, become aggressive and find this person very threatening. Also, of course, time of the day is very, very important. And we often talk about sundowning and other phenomena that are related to persons with dementia. It is very true that late in the day, late in the afternoon, and early evening, we do experience the wandering and pacing that is characteristic of what we call sundowning. In approaching any of these behaviors, regardless of what the cause may be, it's most important to remember that we're not in charge of the patient's behavior. And, ironically enough, they're not in charge of it either. So the only thing that we can be in charge of is our reaction and our approach to their behavior. Here are some helpful hints. And it is always very important to remember that no one individual can ever manage this enormous challenge on their own. Teamwork is essential. If you've known one person with dementia, and this is a wonderful quote, which I enjoy, then you've known one person with dementia. Everyone who suffers from dementia is first and foremost an individual. They have lived a long life. They have accomplished many things. They have likes and dislikes, families, pets, hobbies, everything that you and I have. When they develop a dementia, that does not change. What changes about them is their ability to communicate who they are to you. And so that is why you must anticipate and adjust your reaction to them and your approach to them accordingly. Relate to the person with the disease, not to the disease with the person. This is probably a good rule whenever we're working with any individuals, but it's particularly true with those with dementia. Keep a log and keep it very conscientiously Write down the date and the time and the environment surrounding the behavior you're trying to track. Anticipate and adjust your routine and their routine according to what you've discovered in your Sherlock journal, which you are now keeping. Make a plan for dealing with this behavior, but make a backup plan. Because one thing we know about those with dementia is that they are changeable. Not only every day, they can change from 1 minute to the next and from morning to evening. So what worked perfectly well this morning may be a total failure this afternoon. Have a bag of tricks. Some very successful caregivers actually carry objects with them as well as ideas in their heads which they can use to distract or entertain persons with dementia and help them to be able to perform personal care or to help the patient to get through the day more successfully. Be creative. One of the most important skills that you as a caregiver will develop is the ability to change and the ability to think up new approaches every day for working with these individuals. Know that every caregiver needs respite or a break, and you will also need to take a break at times. Don't be afraid to ask for time to take a break, and don't be afraid to ask for help. Teamwork is essential for successful care of these patients. Also, don't be afraid to say at some point in time, particularly if behavior is aggressive and threatening, that you need help and you need to be rescued from this situation. You need to call on your colleagues and your supervisors and others to help you to be able to maintain your control and help you to help the patient maintain their equilibrium in this situation. It's very important to document problems over time. This gives not only yourself but everyone else with whom you are working a picture, almost a snapshot of what is happening with that particular individual. It also provides clues to the common behaviors that we see in patients with dementia. You can be Sherlock Holmes, and you can remember to record this information in the chart, to report it to your nurse and your supervisors as well as your team members. And it also is important to let other people know of the strategies that have worked for you. And they may not always be successful strategies. Sometimes you will need to let them know about approaches that you have used which have not been successful. We all learn from our mistakes, but also we learn from other people's mistakes. In working with patients with dementia, keeping a document, keeping track of the behavior, sharing it with others is critical to success. Now we come to talking about communication techniques. And this is the heart of the matter in working with persons with dementia. In a typical communication, we have a two-way street. Oftentimes, when communicating with persons with dementia, it is not a two-way street. Most of the effort and much of the thought that goes into the communication will have to come from you. There's a nice acronym called KISS. Keep it short and simple. This is a very good rule to use when you are working with persons with dementia who have impaired brain functions. Your approach matters. You don't want to argue with or get into